Welcome to Datos Health. Unfortunately, our offices are currently empty. Because of the COVID-19, we are all working remotely, but we are handling it well. After all, remote is not a strange concept for us. Remote care is what we do. My name is Uri Betesh, founder and CEO of Datos. Over the past 5 years, we have developed a remote care platform focused on automating existing care processes. We believe in merging remote care with existing clinical workflows to help health organizations increase their efficiency and keep costs down. We do that without having to compromise on the quality of care or the patient experience. Let me introduce you to our unique remote care automation platform. COVID-19 has forced all of us to adapt to a new reality, one in which many medical processes will have to be executed remotely. A reality where many hospital departments or clinical studies will adopt different forms of remote care services. Each will have a specific requirements for the remote care system that can integrate agnostically with wearables, medical devices, electronic records, treatment protocols, or patient profiles. One that puts both the patients and the clinicians at the center of the process with seamless communication capabilities. The healthcare market is desperate for that killer remote care app that will merge the consumer approach with clinical workflows. When we think about enterprise healthcare IT, we all agree that point-specific domain solutions are not an option anymore. Today, it is all about a platform play, and better for it to be a true SaaS platform. Those were our core principles when we developed the Datos platform. We identified 3 main processes: the design of the remote clinical protocol, the patient experience, and the clinician experience. Let's start with our Care Pathway Design Studio, a really cool tool. With a user-friendly drag-and-drop approach, the platform enables clinicians to easily design remote care plans utilizing our robust engines. Protocol engines. If something happens, then do, or on day 14th, send this survey. 3 data engines. Data validation. Did the patient measure that blood pressure reading according to the guidelines? Cleansing. How we cleanse these repetitive blood pressure readings. And context tagging. Was that blood pressure reading with or without medication? And you can do it both for discrete and continuous data streams. Surveys and automatic chat engine that can be triggered based on outcomes or scheduled. Communication engine. On which channel should we send a survey or educational materials? In the mobile app, as a text message, or maybe using our interactive voice response, IVR. The idea is to activate these engines in the most automatic manner. At the end, a personalized mobile app, device integrations, and dashboards are extracted to fit the exact remote clinical program. Then, the next hospital department can now create their own program that involves a whole new mobile app experience with a different set of dashboards and workflows. Okay, we have created a remote care program. Now, let's see the clinician experience at the virtual patient management dashboard. Each program that we design will create 2 specific types of dashboards: population dashboards and patient-specific dashboard. In addition, based on the protocol, alerts and messages will be automatically triggered and delivered at the dashboard or in text or in email message. Full virtual visit console is available to be used either ad hoc or scheduled process. The patient experience is delivered mainly by our mobile platform that supports the personalized patient experience for that care program. It automates and simplifies monitoring, communications, and surveys via video, text, and chat, keeping patients involved throughout their care journeys and increasing their engagement and adherence to treatment. To date, the Datos platform has been successfully deployed in cardiac patients as CHF, LVAD, cardiac rehab, and other programs. Oncology patients in different treatments from oral chemo to CAR-T. Home hospitalization settings, for example, psychiatry or pneumonia. Long-term chronic management as diabetes and hypertension, high-risk pregnancy. And of course, lots of research. During the COVID pandemic, the Datos platform was chosen by the Israeli Ministry of Health to monitor all positive COVID-19 patients in Israel, in addition to many other organizations in both the United States and Italy. Datos is already being used by leading health organizations around the world to facilitate the transition to remote care. Thank you.